Thank you, Steve, and good afternoon, everyone. I'm Jason Resendez, a board member with Consumers for Quality Care. We are a coalition of patient advocates, former policymakers, and health advocacy organizations working together to lift the voice of patients as they demand access to high-quality, affordable healthcare. I would like to thank everyone for joining us this afternoon, especially the members of Congress who've made time to share their insights on this critical topic. We are here today to bring together the healthcare sector with patient advocates to talk about moving the needle towards affordable and accessible high-quality healthcare. We will share findings from new research released today by CQC in collaboration with ALG Research and Public Opinion Strategies on consumer attitudes towards the healthcare system in the midst of our current pandemic. I am pleased to be joined by fellow CQC board member Jim Manley, who will discuss some of the research findings with John Anzaloni and Neil Newhouse. Jim is a seasoned Capitol Hill veteran, having served as spokesman for then Senate Majority Leader Harry Reid in the Senate Democratic Caucus. Over to you, Jim.
Thanks, Jason. It's a pleasure now to be joined by two of the nation's top pollsters to discuss their research for CQC on how COVID-19 has shaped consumer expectations for healthcare coverage, cost, and quality in 2021. Let me first begin by introducing John Anzaloni, the partner and founder of ALG Research. John has polled for numerous presidential campaigns and was most recently the chief pollster for President Joe Biden. I'm also joined by Neil Newhouse, partner and co-founder of Public Opinion Strategies. Neil has polled for multiple Republican presidential campaigns and was the lead pollster for Mitt Romney's 2012 presidential campaign. Once again, let me say thank you both for being here today. Let's begin by saying that, unsurprisingly, COVID-19 has had an impact on consumers' opinions on healthcare. Your research found that while cost still drives the healthcare debate, the barriers that lead to skipping and delaying care, like high healthcare deductibles and programs that increase access to healthcare, like telehealth visits, are extremely important to voters looking to navigate the healthcare system. Let's dig into some of those findings with a few questions. Neil, let's start with you. How are Americans feeling about the healthcare system and the industry as a whole as it pertains to the response to COVID-19?
Jim, that's a loaded question and a complicated one. If you look at this data and you go through the entire polling, Americans are really mixed. First of all, they think we, having gone through COVID-19, the healthcare system is extraordinarily fragile. It's complicated. One voter says, I'm surprised at how quickly the system could reach its limits. You think it's a massive thing, but it's actually fragile. So it's the fragility of the system, but it's also the resilience. Americans believe that the healthcare system came through this really with flying colors. They came away with a new respect for healthcare workers and the system itself, the way it bounced back. But Americans are still of the mind that major changes need to be made. But it's a complicated question, and voters are really of kind of two minds about how they feel about it. Everybody's got a healthcare story to tell. It is right up there with COVID-19 and the economy. It is part and parcel to those two issues. If there's a triumvirate or three-legged stool of issues facing the country, it's certainly healthcare, COVID, and the economy.
And I think that, Neil and I have worked a lot together. We've done a lot of focus groups together. And first off, in some ways, healthcare is part of all of them. COVID is a healthcare issue. As we've seen, people view the system being stressed, but also the system being resilient. When you take a look at the economy, a lot of times when you ask what is the biggest economic anxiety that people have, it is healthcare. So even the economy is very tied into their healthcare concerns. And of course, then there's just healthcare and there's costs. And quite frankly, the narrative on healthcare hasn't changed pre and or during the pandemic and probably post, which is cost. Costs are a big problem with people, and that was the same pre-pandemic.
69% of voters we talked to said they feel like insurance companies are nickel and diming them to death with all the out-of-pockets. 51% say they worry about being unable to afford a high deductible for care they need down the road. 46% say they're concerned that right now they may have to delay medical care because they can't afford out-of-pocket costs. It's those kinds of concerns that really jump out of the survey and make this data and this survey different from other stuff we've done in the past.
And Neil and I actually started picking this up a couple of years ago when we were doing some work together on healthcare in the focus groups, where we get people in a room and we talk to them. We also did some call boards, which were an online focus group for this study. And when you get into conversation about healthcare, it's now almost all about what Neil talked about, the nickel and diming, the copays, the deductibles, all that type of stuff. Every time you go to a pharmacy, every time you go to a doctor, if you happen to go to a hospital emergency room, if you have to go see a specialist, again, deductibles are too large, copays are too large. So everywhere they turn, there's a little bit more money. And what do they say? Well, why is my insurance picking this up? And so there's also another dynamic which over the years, and this is real, employers have started pushing more and more premiums on people. So people are feeling very stressed in terms of the little stuff, which adds up to big stuff, the copays, the deductibles, as well as them having to take a little bit more burden for their own premiums from employers. So they're feeling the heat, and it's real.
And what this does, this goes back and it becomes an economic issue. It's why these three issues, COVID, the economy, and healthcare, are all linked together. It ties right back into the economy and making ends meet for families.
Interesting. So let's take a step back, kind of a broad brush question. Are people willing to trade quality for lower costs?
Nope. No, it's and in fact, throughout the survey, Americans really don't have a problem with the quality of care they're getting. They want it all. They want low costs and high quality. It's probably impossible to do both, but they are not willing to trade off the quality of care for a lower cost product.
Neil, the pandemic has obviously caused many Americans to adapt in different ways, and many of us relying on technology a heck of a lot more in our day-to-day lives, including myself, to work, to learn, etc. Can you tell us about telemedicine and telehealth?
Yeah, it's Americans have embraced it. They've done it. They like it. They want to continue it. It's here to stay. This is nearly 7 in 10 say they are likely to use telehealth after this pandemic is over. I mean, the pandemic has changed not just how we receive healthcare, but how we work at the office, how we do conference calls, how we do briefings, and it's changed the way we receive our healthcare. Americans have embraced it, they like it, and they want it covered.
And I think that this is one of these issues. I think it's good for both ends. I think it's good for doctors and healthcare professionals. And physicians' assistants, and I think it's going to be good for the consumer, especially with more and more households where both parents work, and taking a kid to a doctor can be often difficult, and often you make that decision of whether or not to take them. So telemedicine not only has a majority of Americans in our poll used it in one way or the other, physical and mental, but also for those who have used it, there's a 2/3, I believe, give it very high ratings, and most people are willing to go back and prefer it. As a matter of fact, a plurality of people who have used telemedicine actually say they prefer it in the future.
I know that it's worked for me. Thanks, folks.
Thank you, John, Neil, and Jim. To learn more about the research and to view CQC's Negotiator Guide to the Healthcare Concerns of Consumers, visit us at www.qualitycare.org/research. Thank you again, and I hope you enjoy the rest of the program.